Sorry, I'm on mute then, I'm chatting away. I'll call them in just to make sure that they're here.
All right, perfect.
Maria, it's Angie. While we're waiting, I can't see the chat box. Has everyone else got?
Neither can I. I wonder, Victoria, have we got a problem with the chat box?
I can see it.
It's happened a few times, I think, when we've upgraded. Some calls I've been on, you can't always see it, and we've had to send other links out. I'll cope for today, but if not everybody's got it, we might just need to check the link for next time.
Will do, Angie. I'm going to need your help then, Victoria, because I can't see chat box either. So yep. I will need your help to relay what's coming in there and relay questions and things, if that's okay.
Yep.
So we get started then. Welcome everybody. My name is Maria Riley. I'm Associate Director of Strategy and Improvement. Welcome to the monthly Improvement Forum. If you just bring up the agenda for us, Victoria. Fabulous, thank you. This is a monthly forum. Main focus of the event really is a spotlight on improvement, presentations from people across the trust, sharing improvement success, outcomes, good news stories, hopefully. So that'll be the main focus. We've got presentations today on recycling, on the Vaccination Hub and the Critical Care Friendship Group. Stacey Burton, our improvement facilitator, will talk about bringing improvement ideas to life. I'll update a little bit on the training programs that are available, and then we'll just finish with sharing and celebrating success. So we've got Sally first, and I think Sally's just joined us. So over to you, Sally. Welcome.
Hi, my name's Sally Ludder, and probably most of you know me, and I'm a Health, Safety and Environmental Advisor at the Trust, and one of the projects I've been working on is recycling, so I just want to share that with you today. So firstly, I just want to read the waste hierarchy. So there's 5 steps to the waste hierarchy, as you can see on the slide. First step is prevention, second step, reuse, third step is recycling, which obviously we're going to focus on today. Fourth step, other recovery, and finally, disposal. Next slide, please. So the progress so far that we've made then as a trust with the waste hierarchy is on the disposal side, we are actually a 0 waste to landfill site. So that's good news. None of our waste goes to landfill. The majority of our waste goes for what we call other recovery. So all the domestic and offensive waste is disposed of via energy recovery, and the offensive waste is actually compacted on site, and that saves both money and haulage. We have also food waste collected from the cafe at the front, and we also installed some garbage guzzler food waste digesters in the Sodexo kitchen in 2020, which breaks the food down and puts it into a waste product, which also goes for other recovery. We then have some recycling on site, and that's the area that we're trying to increase. So we've got a comprehensive system for paper and cardboard across the site. You will see the large bins for the paper and cardboard on the corridors, and that does get compacted on the site and all goes for recycling, and we actually get rebates on that, which is really good news. We segregate out any metals that we get, like broken metal lockers, old metal bins, those kinds of things, and we have a metal skip on site, and that all gets recycled. Batteries get recycled. The confidential waste, that actually gets sent off site for shredding, and then all of that is recycled. And then we have got the staff-led plastic bottle and containers and tins and cans recycling, which is the area we focus on and want to improve at the moment. We do quite a bit of work on reuse. So we've got the war pit system that was launched in April 2019. And we also have a system where we donate to charities as well. The charity that we've worked in partnership now for a number of years is called National Police Aid Convoys. We've also done quite a bit of work on preventing. We've had things like the Bring Your Own Bottle campaign, We've had the reusable sharps containers now on site for over 10 years. We've been using them, and things like reusable mops that domestics use are also a good initiative. Next slide, please. It's very important, though, that as a whole, we do consider the whole product footprint, because it is much better actually prevent the waste from occurring in the first place, or have reusable items rather than recycling. So it's important that we always think about the entire product footprint, not just the disposal stage. So can you get reused products rather than buying new? So, you know, it's important that you register on Warpit or in your teamers and you use and check Warpit, and also add items to Warpit that you no longer need. It's important that we do support the whole of recycling. So as well as trying to recycle what we use on site, we also try and buy recycled products as well. So for example, a couple of years ago we started buying the recycled paper, and it's important that we look at trying to buy recycled products. Also refurbished products, like the compactor we purchased for the offensive waste. That was a refurbished compactor, which, you know, was both cheaper, but it's better than buying new for the environment. And there's things like in theatres, things like reposable instruments that they could look at using as well. And then we also need to consider things like in the whole product footprint, manufacturers and distributors' environmental credentials, such as distribution of a product. Is it made in the UK? Can we use local suppliers? We then need to consider obviously the usage. So obviously it's better to use reusable use where you can, rather than single use. Think about the lifespan of the product. You know, can you buy better products that will last longer? Can we get items with replaceable parts, like the new bins that we've now got on site? You can actually replace parts of the bin. So, you know, if the lid cracks, you could just buy a new lid rather than having to replace the whole bin. Also, for some products, you need to think about things like energy and water usage as well. And then after the use of the product, we need to be looking at whether the product and the packaging it's in can actually be recycled. Just an example, a really simple example to talk you through on product footprint, a comparison between tap water and bottled water. So if we're looking at tap water and bottled water, sorry, my phone just went off. If we're looking at tap water and bottled water, it's important that we, this is a really simple comparison, because the carbon footprint of tap water is about 1 to 300 or 1 to 1,000 from studies, compared to bottled water. So it's like between 300 and 1,000 times more less carbon produced when you drink tap water from the tap in a glass, or a reusable bottle, obviously, rather than buying, you know, bottled water in single-use plastic bottles. And the carbon is mainly coming from the packaging and transport. And I think that's a really simple example, but you can see the huge difference that it makes to the carbon emissions. Next slide, please. So back to recycling then. The recycling aim is to have a comprehensive recycling system across the site, which is accessible to all departments. So as you can see from this slide, the current systems we've got in place is we have got pretty comprehensive system for the paper and cardboard. So staff take the cardboard and the paper and small paper bins to those large corridors for recycling. As I said, that's then compacted on site and goes for recycling. And what we're looking at doing with the plastic bottles, tins and cans is providing departments with these small grey bins with the red top. We've used red because that's the colour code for plastic. And then the staff will take those to, what we currently have is groups of staff taking those recyclables to external bins, which you'd think was simple, but it's not that simple for all different groups of staff to do it. So for example, in a ward, it can be quite difficult to ask staff to do this because they do get quite a lot of recyclables from the ward areas. So it's not really that practical in a lot of areas to be taken outside. So what the plan is going forwards then is we're not going to change the cardboard and the paper recycling, but we're going to expand the tins, cans and plastic recycling by using 360 litre bins, red bins, adjacent to the cardboard wheel bins, which will make it much more accessible. And then the porters will actually decant from these 360 litre bins into the 1100 litre bins, and then that will be collected by the waste contractor. So this is an outline of how the new system will work. So the paper and card system works the same. So paper and card into the blue bins. Porters then take those bins and tip them into the compactor on site. With the tins, cans and plastic bottles, we'll have the small bins in the department, so the small grey bin with the red lead. It will then be mainly domestic services staff, but obviously any staff could decant into the red wheeled bins. They need to have the waste bagged, and then the porters will actually decant those bags out and transfer them to the 1100 litre bins, and then present them for the contractor, and the contractor will collect them with a refuse collection vehicle. Now, we have started it successfully on Eastwood Durham Ward, so if you go to the lift lobby near Eastwood Durham Ward, you will see the first small red wheeled bin there, and in the departments they have got the small bins as well, the 50 litre bins in their staff and kitchen areas for the recycling. The intention is then to roll this out floor by floor onto the main wards and then into the rest of the hospital. And that's it. Thank you. Any questions on that?
Thanks, Sally. It's really good to hear about some of the brilliant improvements happening around our carbon footprint ambitions. Are there any questions?
Yes, Angie, if you'd like to ask. You can see Angie's hand.
Sorry, yeah. Angie, do you want to come in?
Thank you. Not a question, just a comment, Sally, to say thank you not only for all the work you've done on the practical side, but also helping us get to a position where we can measure our improvement, which from an environmental perspective has not been easy. So you'll know, but others may not, that our green plan has been through board now and is a key part of our strategy that is going back to board again tomorrow. So at least we can measure some of the improvement, which is no easy task in this circumstance. So just a big thank you for supporting that work.
Thanks.
Thank you, Angie.
Luke, did you want to come in?
Hello, yes. Thank you for that, Sally. I think I missed the first part of it because I mixed up with the rooms, and I might have missed a little bit of what Angie said, so apologies if I repeat kind of similar things, but it was just to do a big push to how many barriers and kind of how difficult this was to get off the ground at the beginning, so for some of the environmental stuff, so just kind of big thanks to you and celebrating how well you've done it and how far we've come, because I think people are now getting on board, so well done.
Thank you, Luke, and could I also thank Stacey as well for her help with this piece of work, which was really, really helpful. Thank you.
I think you've also got another exciting piece of work ongoing, haven't you, Sally, that's hot off the press, working with Stacey on a brilliant improvement idea that you've seen in Bristol with anaesthetic gases?
Yeah, we've got a meeting shortly with Nigel Stacey from Theatres and with Stacey. One of the things that was quite surprising, which came from the NHS net zero plan, it's quite surprising where all the carbon emissions actually come from. And actually, when people think about environment, they often tend to focus on waste and things like that. But actually, waste is really, really low. It's probably only about 1 to 2% of the carbon footprint of the NHS. So although it's important that we do focus on waste, it shouldn't be the main priority when we're looking at carbon as a whole. Now, actually, the anaesthetic gases is actually at 5% of all NHS emissions. So that's really, really high, and it's because of the type of gases in the anaesthetic gases that they're really carbon intensive when you look at the carbon equivalent. So that's why I spoke to Stacey, and then we arranged a meeting with Nigel to see if that's something that this trust could also look at, whether we can try and reduce the carbon impact of our anaesthetic gases emissions on our site.
Brilliant. We'll keep a close eye on that one. Thanks, Sally. Stacey Wilson, you've got your hand up.
Hi, yeah, just a quick one. Sally, anaesthetic sits within my care unit. I'm one of the service managers in surgery, and I know that our clinical director, Nick Spittle, has brought this up a few times in our catch-ups and as part of our priorities work. So it'd be good, I think, if perhaps we as a care unit can link in with you and support you with that, because I was really shocked at what Nick was telling me, that some of the anaesthetic procedures sort of produce emission wise. So yeah, I'll link in with you after this meeting.
Yeah, that's great. I mean, my starting point was I didn't really know where to go, so I thought, well, Stacey's got a lot of contacts, and then the academy is really good, so that's why I approached Stacey and Nigel. But obviously through that, then we'll find out, you know, how we can improve things as well. So that's great. And obviously don't want to exclude anyone. It is very important. I mean, we want to be led by people doing the work and people that understand it. I mean, it was totally new to me. I mean, the other
but it's just good that like I say, we've been talking about it, and it's
like
good to know
together,
that something's happening. Yeah, fab.
Yeah, thank you.
Fabulous. That's what this place is all about, linking people together who are interested in delivering the same ambition. So I think both Stacey's combined, you've got working with you, Sally, which will be fabulous. Thank you so much, and we look forward to hearing from you again in a few months on how that pilot's gone and hopefully seeing some outcomes. But thank you.
Thank you.
Okay, hand over to Stacey Burton to talk about the work in the Vaccination Hub. Just looking whether Stacey's with us.
Sorry. Sorry about that. I was muted. So good afternoon, everyone. So I just want to keep everybody updated to what we were getting up to in the Vaccination Hub. So I'm just going to start with just a little bit of background. So we was really lucky on this site. We was one of the 50 vaccination hubs in the country. We were giving out the Pfizer vaccine, and we managed to give it to over sort of 4,000 members of our staff, over 90%. And we also sort of linked in with other care homes, residential homes and patients. So the first 2 weeks, the hub was kindly staffed by DCHS. It was a little bit of a win-win for both of us because we all got upskilled, ready for the community hubs to come into place. I sort of came in just after the 2 week when DCHS pulled out. The hub was made up of CRH staff predominantly who were working extra hours to support the service. So the first vaccination was given on the 8th of December by our lovely Gemma Court. 7 weeks later, the 10,000th vaccination was given. So it was one of our community colleagues that actually received the vaccination. So that was really nice moment to achieve that. So who did we give the vaccine to? So we vaccinated in total 4,298 staff, 603 patients. Other NHS staff were 3,251, 627 social care and 1,501 care home staffs. And out of that great big number, we only didn't use 9 vaccines for a number of reasons. Just the fact that there might have been a problem with the syringe, the needle. One got dropped and one got squirted in somebody's eye. So they were all, it was not wastage, it was genuine problems. So this is just a data chart, an SPC chart of the vaccines that we actually gave, plotted on a daily basis. I just think it highlights the really nice sort of how the rollout was sustained towards the end. So as you can see, the day one, they did absolutely amazing. They gave absolutely loads and loads of vaccines to people. But at this point, we weren't having to recover patients for 15 minutes. So we were able to give and go. We did run into some problems that did change the national picture of needing patients to stay and remain for 15 minutes post-vaccination. So that's where you can see where the numbers slightly drop, where we had to sort of formulate very quickly a plan B. Then the numbers went up. At that point, you can see that we're only really running a 5-day service. The dots, the orange dots at the bottom in December, they show the week that we had off between sort of Christmas and New Year, and the drop on the 24th was we only did a half day on Christmas Eve. I think that we did about 95 on Christmas Eve. Then we came back after the New Year all refreshed, and we really did start a 6-day rollout, and we was really maintaining the numbers. As you can see, the drop was the Sunday where we was only 6 days, but from the 12th of January we were really quite consistent with the number of vaccines that we gave, right up until the day that we paused, where we absolutely smashed it. We got nearly 400 on that day. It were busy. So this is some of the team that was in the vaccination clinic on the day that we did the 10,000. We were a really big variety of people coming from all different backgrounds. We'd got consultants, we'd got pure NHSP workers, we've got midwives, pre-assessment, dental nurses. You just never ever would get a mix of different disciplines all working together, and that was really, really humbling, and we all learned so much from each other and really did get on really, really well. So I just asked the team how they felt about working in the vaccination clinic, and I just asked them to sum up in one word how they felt about working in the clinic and working with different people. And these are a lot of the words that they came back in: privileged, inspirational, supported. They did like the networking, so I thought that was really, really quite interesting. Fabulous. And it was just all really, really positive. And I think if we could just bottle some of that and shake it around a bit, I think it would be absolutely amazing. But the vaccinating staff are only part of the jigsaw puzzle, and it's really important to recognise that without everybody else that works behind the scenes, this really would not happen. So I'd just like to say thank you for helping us help others. So Claire Carson and her central booking team were just amazing. They worked out the demand, the capacity. They were really instrumental in making sure that we did not waste a drop. Martin Shepherd and Janice Bradshaw from pharmacy were fantastic. Again, the domestic catering and portering teams, they kept us all hydrated, and they did loads of cleaning and just really supported us. And then Kerry Daff for supporting the admin side of it, because all of those jabs need to be inputted. So it really is a big team effort. Thank you. Any questions?
Thanks, Stacey. It's just a brilliant whole team CR8 effort, and if you could have told people that we could do that on top of an incredibly challenging operational day job at the same time, you would think that was impossible if you planned to do it, but we did, and it's just incredible hard work, and thanks to everyone involved. I think the other thing is, Stacey, in doing that, you've taken every opportunity, haven't you, to kind of let people know about the Royal Academy of Improvement and how to get involved with improvement. So if you've had your vaccine, you've probably been inducted to improvement at the same time.
I never like to miss an opportunity.
Absolutely not. Luke, did you want to come in?
Yes, thank you. So just a couple of points really. First of all, the SPC chart I just thought kind of really illustrates the impact of a 7-day service. So when we got to the end of it, I thought that was fantastic, just to see where suddenly we got that row of kind of points above the mean. So that fantastic doing an SPC chart, and I know I'm a bit of a I'm very pro SPC, so thank you for that. And then the other thing was just on reflecting on the whole service. So it was even kind of how well it ran. It was recognised everywhere. So I remember even my dentist told me, "Oh, I'm coming to Chesterfield for my vaccine. I'm so excited!" And that's all the way in Sheffield. So you know, so it was well recognised. So kind of great effort. But the only other thing would be, where can we learn and use this process again? So obviously it's been very successful. So have you got any thoughts about how we could then use this moving forwards in other areas?
I think the flu vaccine's a big one that we could look at, because obviously we've beat the flu target that comes every year. Whether it is because it's new, or whether there's something educationally, queue-wise, the way that people were booked in. I think that there's lots and lots that we could learn. I mean, I'm a big one. Hit it hard and hit it fast, I think, rather than spread it over a long time.
Brilliant. Sounds good. Thank you.
Krishna, did you want to come in?
Yeah, no, I was just saying about sort of the vaccination. I mean, there was lots of constraints in the early days. So the unsung heroes sort of regionally and nationally were the pharmacy guys who absolutely sort of put everything in, all sorts of wheels in motion, and were really the unsung heroes. And then Claire Carson and the team, so the booking was just phenomenally difficult. So we've learned a lot through it. And yes, the flu vaccine will already be, that's our plan for this year, to do exactly that, Stacey, isn't it? To hit it hard and hit it fast. But we've got a really good methodology now of how we do it. But I think that for me is the feedback from the patients themselves, and also sort of the recipients of the vaccine. It was so positively received, sort of the follow through of patients, and you can see that on the SPC chart. It's a shame that we had to go into, as they've classed as hibernation. But we're really constrained with the amount of vaccine and how we were able to give it, which is why you've got anomalies with the numbers on your SPC chart, Luke, because of those constraints. But we'll be up and running back again, won't we, on the 1st of March with the second dose. So that's really, really positive.
Thanks, Krishna. Angie, did you want to come in?
Thanks, Maria. I'm just going to reiterate everyone's congratulations and well done and thank yous, and brilliant effort. And just to build on Krishna's point, yes, we've got second dose that you'll all be ramping up and ready for. We have been asked about going forwards, whether we want to continue with hospital hubs now that community infrastructure is set up. So Krishna and I would be interested to hear people's views around not only the flu vaccine, that I think is a really good point that you've raised, but what role there is for hospital hubs going forward. So not for now, but just keep those thoughts and suggestions coming through to us, please.
Thanks, Angie. Any more questions, or shall we move on? Thank you, Stacey. Brilliant outcomes, brilliant presentation as always. Kathy, you're going to talk to us about Critical Care Friendship Group. Hi, Kathy. You're struggling to get off mute. I think Kathy's struggling with connection. Are you there, Kathy?
It's saying on hold on the participant list, Maria.
Yeah.
So it must be a connection.
Victoria, do you want to try and dial Kathy in?
Yep, I'm just trying to do that.
AD, you've got your hand up.
Yeah, I just wanted to probably chuck something in there as regarding why we might be having a few connection problems. You know, when obviously we've had the 2 room links, I think I've just gone back to the old link, and I think there's a lot of people that have just stayed in that room. So I think they need to kill that previous connection.
I've just closed that meeting down permanently.
Okay.
So yeah, but Kathy was in there, but she was on when all the messages were put on about transferring over. So hopefully she's just having a few system problems.
Yeah, she should be here now, but I can't take her off mute, so.
Hi, Kathy. Are you back with us and able to join us? There you are. I can see you've come off mute.
Yeah.
Hi, Kathy. No, we're still struggling. So what we'll do, Victoria, if you move us on past Kathy's, and then we'll try and get her to come back if we redial her in. Can we just fast forward and we'll keep going and come back to this? So bringing improvement ideas to life. Stacey, did you want to come in and just do a bit of a update on how people can get in touch with you and how you can support?
Yes, no problem. So I'm always available via email. So it's just Stacey Burton. I think that there's only probably one of me. It's all the world can stand. Also, there's lots of posters dotted around the hospital, and there's a QR code on the posters that if you just want to quickly zap on your phone, it'll take you straight to our improvement link where you can pop in any ideas that you may need support with, and I will get back to you as soon as I possibly can. There's also the intranet page, the Royal Academy of Improvement, that you can go on and you'll find share your ideas with us. I think the biggest message is that there's, you know, it doesn't matter if it's a small idea, any idea that has an impact on your working life, on patient care, that improves anything, you know, I'm happy to sort of come and help and support and guide you through whatever process you want. Also, we have the Academy newsletter that we've got in a new revamped format again. So that's full of loads of ideas on there. So, you know, something you might just think, why don't we do something like that? But where do I start? And sometimes it's just being guided in that right direction, and that's what I'm here to help everybody do. And there's this beautiful improvement newsletter.
Thanks, Stacey. I
No
think
problem.
one of the areas that across the team, Stacey and others, Christy, Luke, have been supporting with over the last couple of weeks is the COVID virtual ward. A fabulous example of an improvement that has gone from first meeting to scope the potential to launch yesterday within 13 days. Again, another whole team CRH effort, lots of work from an administrative perspective, from protocols to nursing rotas to everything, really just pulled together. And Stacey, Christy, you've supported that work, haven't you?
Yes, yeah, it was brilliant. Rapid improvement, that's what, yeah, really good team effort, lots of different skills all used to help that come together.
And it's another area where we've made sure that we're capturing the data from the beginning, so we can evaluate, we can see the benefits from it, and we can have a think about how that kind of virtual ward could be used for the future beyond COVID, if I dare say those words. So improvement training programs, I'll keep going and then we'll see if we can come back to Kathy later. So I'm going to say Stacey again, but the virtual introduction to improvement. So we used to have a one-day introduction to improvement in the Innovation Centre, which was open to all staff who wanted to find out a little bit more improvement. Stacey and others in the team have worked on taking that into a virtual format. So that's open to staff to start booking into. If you've got an improvement idea, of problem, of frustration, get in touch with us. That workshop will take you through the first steps of how to define your aim, what you want to do, understand who your stakeholders will be, establish your measures, and then plan how you'll test your improvement idea. So 3 to 4 hour session, and then what we do, Stacey and others will support you through with the bringing your improvement idea to life past that point. So we've had to stand down a couple of those because we were busy with vaccine programme and other things, but we definitely are planning to get going on the 16th of March, and there are places available if you want to schedule into that. You just move next slide. Thanks, Victoria. Can we see whether we can get Kathy back again, Victoria? Or
she was there, but she's gone again.
No, she's not there at all. I will move on then. So these are a few slides that go into a lot of different places. So they go into the monthly hospital leadership team report, on the improvement report that goes there monthly. They go into the Finance and Performance Committee report. So they update on all our improvement success and things that we really want to shout about and share. So just a couple of things this month. The Ashgate Hospice Supportive Care team have launched the Wobble Room. So that's a virtual space open to our staff and others across the North Derbyshire community, where you can go for a wobble, pause, recharge, and be supported to move on. Despite the operational challenges, Team Robinson have got their gold ACE accreditation in sight, so they've been driving forwards their improvement plans. You can see that they've been working on who their leads are for the different areas and how they're going to achieve gold standard. So that's brilliant that they've still got their eyes on improvement despite the operational challenges we've had. David Sandler's talked to us before at the forum, but he's now our very own celebrity consultant after he showcased his work on the And I Look Like This badges on Look North. It's a really brilliant set that he had in there, and I have seen that that's been extended, and other trusts have taken up that idea now, which is brilliant. Just move on, Victoria. So we've launched one of our, something I'm really excited about, a service user partnership. So this is asking for volunteers across our community to support our future healthcare professionals to deliver telephone and video clinics. We ask people to sign up, and then they will, with a student, give their medical details and history and things like that, and it just enables our new healthcare professionals to learn how to deliver the new format of appointments that we'll be using for the future. Our IT team have been working really hard to develop the admissions app, and we hope to bring that back here in a future forum with a lot more detail. But it's going to transform the way that we admit patients at the bedside without having to log into PCs and getting into Medway. So that's a fabulous improvement for the future. On World Cancer Day, I've talked before in the forum about the videos that some of our cancer consultants have done, published about reassuring and supporting patients, and we republished all of those via social media on World Cancer Day last week, and they're hopefully supporting patients to reassure them that we're open and reassure them that they should be presenting to our services if they're worried or have symptoms that they're concerned about. And on the final slide, because this is a set of slides that go into other forum, it's so good, we said it twice, whole team CRH effort in terms of the COVID vaccination programme, and Stacey's already talked you through. I'm just having a look whether Kathy, are you able to join us yet? Hi, Kathy, can you hear us now? No, I think we're still struggling. Okay, what we're going to do is we will reschedule Kathy and we'll get the IT glitches sorted, and hopefully you can join us for the next forum, Kathy, and talk us through the critical care friendship group. In terms of other things, was there anything else, other improvement work happening that people want to share and talk about? We've got a bit of time if there's any good things happening that people want to share. No? Okay. Well, thank you very much for joining us. We will publish the this online, so staff who weren't able to join us can catch up with the work on recycling and the vaccination programme. And Kathy will be in touch and get you rescheduled for next time. We hope to see you next time at the Improvement Forum, but thank you for taking the time to join us.
Thanks, Maria.
Thank you.
Thank
you.
Bye-bye.
Thanks, Marie.
Bye.
Thank you. Bye.